Hey, I'm Vic Senese and welcome to UroNurse News. Today we're talking about something that might surprise you. Winter isn't just cold, it can actually increase inflammation throughout your body. And for people with chronic conditions like arthritis, diabetes, heart disease, or autoimmune disorders, that inflammation can hit hard. So, you might not know it, but every day that it hits, you're getting colder. And with record Arctic lows across the country, boy, hasn't this winter been a bugger. Cold care is even more important than ever. Here's the science. Shorter days, less sunlight, lower vitamin D. Cold temperatures, less activity, more indoor living. Holiday comfort foods, pro-inflammatory eating patterns. Makes sense, doesn't it? Together, these factors create a seasonal peak in inflammation, making chronic conditions more likely to flare. Conditions like arthritis, heart disease, and autoimmune disorders really feel it in the winter. Believe it or not, research shows that clear seasonal patterns in inflammatory activity. Now, I kind of like being out in the snow and playing in it, but believe it or not, research shows clear seasonal patterns in inflammatory activity. In a landmark study, it looked at U.S. population data from 1999 to 2012. They measured C-reactive protein and white blood cell counts in the winter versus the summer. What'd they find? Inflammation markers spike in the winter. Other studies reveal that genes promoting inflammation are more active in winter, while anti-inflammatory genes dip. Cold exposure triggers vasoconstriction and raises inflammatory markers. Maybe that's why people go running down to Florida during the winter. So what's the impact on health? For people with arthritis, winter brings joint stiffness and pain, worsened by barometric pressure changes. In heart disease, cold constricts your blood vessels, raises blood pressure, and increases cardiovascular strain. Heart's working harder. Some studies show a 37% higher risk of heart failure mortality in the winter. These aren't just coincidences, they're your body's natural response to the stress of winter. And like I said, this winter's been a real stressful one. We've had record colds and record amounts of snow. So, what can you do? Let's talk about anti-inflammatory nutrition. Your omega-3s, things like the fatty fish like salmon, mackerels, and sardines. Other things like walnuts, flax seeds, and chia seeds. Spices, turmeric with black pepper and ginger. Good spices to use. Antioxidants, berries, leafy greens like spinach, kale, and Swiss chard. Now, here's the rule of thumb. You want, like this plate you see here in my picture, aim for a colorful, varied plate. Warm salad with greens, berries, some walnuts, plus salmon or ginger turmeric tea. Simple, practical, and powerful. Not everyone can get perfect food or sunlight daily. This is where supplements can help. But be intentional. Vitamin D3, based on blood levels, 1,000 to 4,000 international units daily. Magnesium, 300 to 400 milligrams. Glycinate or citrate magnesium. Omega-3 supplements, those fish oil pills are algae-based forms. Curcumin or piperine enhances absorption. Now, testing your levels are key. Blood panels can reveal hidden deficiencies, and correcting them can make a huge difference. I actually found out from my own physician that vitamin D, which, as we talked about, kind of goes down during the wintertime because of the lack of sunlight, that a dose of vitamin D's can kick it back into working again, so you don't have to stay on it even. So talk to your doctor if your vitamin D is low about giving it that booster to kick it back into style. Now, daily habits do make a difference too. Gentle indoor movements like yoga, stretching, marching in place for 10 to 20 minutes can lower inflammation and boost circulation. I subscribe to one of these channels that has exercise programs and just go and I do them every day. Get into a habit to do it daily. It's going to help keep you moving. Now, it doesn't have to be drastic. Small, consistent actions add up to big results over time. So winter doesn't have to mean suffering. With the right combination of food supplements, movement, and you can take control of your seasonal inflammation and protect your health. Always want to take care of your health. Hey, tomorrow on UroNurse, uronurse.com that is. In this episode, I sit down with Dr. Jason Kim to explore glean ambulatory urodynamics, a game-changing way to study bladder function in the real world. Forget those going into the clinic for a urodynamic test. This innovative approach collects real-life bladder data as patients go about their day, giving doctors deeper insight into overactive bladder, urinary incontinence, voiding dysfunction, and complex lower urinary tract symptoms. This thing is so cool. It works inside and it works over time, which you never get with a standard urodynamics. I always say urodynamics is like taking a picture. You're getting one little section of what's happening during somebody's day. This one will record a day's worth of data. Anyway, we're going to talk about that tomorrow. So that's all for today with UroNurse News. Thanks for tuning in. Make sure you join us next week when we'll be breaking down the latest in urologic care, share cutting edge research, and answer the questions that matter to you the most. And now, bring it on with the choir.